Today's episode is going to be about rapid release therapy. Some people refer to it as RRT. It's another handheld device, totally different than shockwave therapy. I use this probably for just about everyone because I'll do the back or sometimes the calves. And it's amazing how it relaxes 99% of the people. You know, it makes a little like noise because it is vibration. It's a high frequency vibration unit, which is excellent. There's a few different heads on it, all in the same handheld thing, and you use different heads for different areas of the body. And it's amazing how the frequency and the vibration stays the same, but it gets distributed differently through each head, which makes it, to me, just amazing. Like, you know, it's something like that. These people who invented these things are brilliant. And it works. It relaxes a lot of people, if not everybody. I say a lot because sometimes some people, you know, it takes one or two times for them to become comfortable with it. What I do hear from most patients, if not all, is that they sleep better that night. And it definitely helps for me with the chiropractic adjustment. You know, I'll do that before usually, and it relaxes the body, so the adjustment just flows easier, less force. And it's a machine. It makes noise, right? What's interesting about this one, I mean, it seems like most of the things make noise, I guess, because I make a lot of noise sometimes, right? I always figure if the person could, you know, get relaxed with me talking, these other things will do the same, which made me think about that because the rapid release and the shockwave both make a noise. The shockwave is more dun, 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 dun. And then the vibration is the same thing. It's like an important thing to keep in mind when you're thinking about the rapid release therapy is that it's not those little muscle stimulating things that you see, you know, in Amazon and on the store, those thumper type things. This is a specific unit. It definitely costs more than most of those because it works in a different way. It's vibration therapy that's effective, and it's been designed to help, you know, mostly athletes and people with, you know, muscle problems. A lot of athletes do use it before a sporting event to keep them loose, you know, especially if there's a problem area, because it's just like about a 6 or 12 inch like stick almost that it looks like. It's green usually, and it's got a rounded head with the other you know, heads alongside of it, and you pick which one you want to use for certain areas. And it vibrates. A very simple vibration, but very effective. You got to know how to use it, though. I know sometimes people use things for the wrong things. I don't recommend someone to use it if they're hurt, unless they've been diagnosed and they know what they're doing, or a doctor told them, or another health care practitioner. Let them know this is okay for you to use or not. So rapid release is just a separate device that is very effective for musculoskeletal type stuff, and it's like I said, it's not like those other ones that you see out there. You should look it up. The reason I like it too, also, is that you don't need a lot of time. I spend anywhere from 5 to less than 10 minutes on an area, usually 5 or less, and then I just move to another area, and that's usually all it takes, you know, to be effective. I think too much isn't as beneficial, but you don't need it. That's what makes it even easier and better. One of the things that I use it for, which I always assume, you know, that I'm talking to people who are familiar with me and know what I do, is for adhesions, scar tissue, you know, tight muscles. You usually have those things associated with them, and this helps break it up tremendously. You know, people who had an area of their body that, you know, I could do it with my hands, but it takes longer, and sometimes it's a little more painful. And then I introduced a rapid release, and it just works. Some of the reasons people ask me about rapid release, especially existing patients, is because if they're doing something in the garden, right, or they're moving or exercising, they're sore. Not injured, but sore. It helps tremendously. Relieve the soreness, get blood and oxygen moving. So it's a good thing. Like my brother was helping somebody move a piece of furniture, and it hurt. It hurt his lower back a little bit, but it wasn't really, it was hurt, but it wasn't really hurt. I just did the rapid release, and I released it up 1, 2, 3. One of the ways I use rapid release in my practice is for acupuncture points, acupressure, we spoke about earlier, because it doesn't hurt usually on that point, and it does loosen up the muscle in that area and get blood flowing. So sometimes I'll do that before I do a point that I think is going to be a little painful for the person. What I'll do is I'll test it. I'll press them first, and it hurts a lot. Then I say, let me just do a little rapid release, and then I do it again, and it's usually better. And I also use it with the adjustment. I think it definitely helps the back loosen up and makes the adjustment, you know, just a little easier, go a little smoother, and decrease range of motion. I get tremendous results with that. Like if a person can't lift their arms a certain height or turn their neck to the left or right, usually 5 minutes and there's increase in their range of motion. The main reason I use rapid release therapy is because part of my plan, my overall, you know, big picture plan, if you want to use those words, because it relaxes the body. And when the body's relaxed, it just works on a more optimum level. When you could do it faster, it just makes more sense to me, right? 5 minutes of rapid release relaxes most people, improves blood flow, gets you feeling better, and boom, there you go. You got a nice addition to the chiropractic adjustment. I usually get calls sometimes, on different devices that I use. Oh, I want to come for rapid release. And I'm like, you don't know if you need rapid release. Let me look at you. Don't worry, I'm not going to charge you. If you're a candidate for rapid release, even though I say use it with most patients, some people don't need it. Maybe not in the first visit, maybe the second. So when people call for that, I understand. I'm speaking about it kind of separately too, right? But it's incorporated to everything that I do. And I'm happy to answer any questions about if you're a candidate or you think you would benefit from that being incorporated into your treatment plan, which 99% of the people do benefit from it. Hey guys, do me a favor, follow us and like us on social media and visit our website, NewJerseyTotalHealth.com.